Hi, this is Izzy with Climate Academy, here to talk about the coronavirus pandemic. Right now, we are in a dire situation. First, let's define it. The coronavirus, or COVID 19, is a respiratory illness that can spread from person to person. It's a virus that looks like this. It works like a typical virus does. However, the risk is that it's very contagious. Risk of infection is higher for those who are in close contact of someone known to have COVID 19, for example, healthcare workers. For many people, catching COVID 19 is like catching a cold, but for many others, it's much more dangerous. The people at risk are older adults, usually 60 or above, heart disease patients, lung disease patients, immunocompromised people, people with asthma, people with diabetes, and many other chronically ill folks. It's important not to miss the illness because you may be one person away from someone who is at increased risk. Even for young people and those who are healthy, coronavirus is a serious disease and necessary precautions need to be taken. So let's define the symptoms. For a mild or beginning case, you may have a fever, dry cough, or shortness of breath. Emergency warning signs include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. So now that we know what COVID 19 is and its symptoms, what can you do to prevent it? For those at low risk, you should wash your hands often with soap and water for at least 20 seconds. Use an alcohol-based hand sanitizer if water and soap are not available. Avoid touching your eyes, nose, and mouth with unwashed hands. Consider obtaining a 2 week supply of prescription and over the counter medication, food, and other essentials, but do not take everything. If possible, self-isolate. Establish plans to work from home and cancel events. Stay plugged into local, state, and national public health authorities. The most important thing to do right now, however, is practice social distancing. If you are at high risk, stay at home if possible and limit social interaction. Even if you are not at high risk, do your part in protecting others by only going out if necessary and avoiding close contact with others. If you think you have COVID 19, you should stay home except to get medical care. Call your healthcare provider and let them know your symptoms. Ask about testing. Avoid contact with your pet. Wear a face mask and don't share personal household items. Clean your hands often and clean and disinfect all high touch surfaces. How can you help those most affected? You can call your congressional representatives and ask them to support Meals Act, sponsored by Rep. Omar, so that students who rely on school meals will still have access. Check on your neighbors and bring them supplies if they need. Participate and support mutual aid and programs. Make sure to take care of yourself and your mental and emotional well-being as well. Check on your phones with video calls and have fun online parties. Social distance yourself and stay at home if you can. Even though what has been going on is scary right now, it's important for us to remember to not scapegoat others. There have been various reports of harassment of Asian Americans, and this is not okay. It is unacceptable to call the coronavirus Chinese virus or Wuhan virus, as this stigmatizes people of a certain race and can lead to harassment or violent attacks. This virus has a name. It's called COVID 19, and it is important to respect this. Even if the president does this, that does not make it acceptable. Instead of blaming each other, we need to work together to combat this threat we are facing. Here's how this relates to the climate crisis. Climate change exacerbates and makes diseases such as coronavirus easier and faster spreading, as well as more dangerous. There is evidence to show that climate change warms the planet and melts glaciers. There are hidden dangerous diseases that are being spread into the air and into humans and into the future. This picture shows that there has been decreasing levels of pollution due to COVID 19 in places like China. However, saying this is a good thing is what we call eco-fascism. We reject the notion that humans should be dying, and that is a good thing because pollution levels are down. We must make systematic change, not encourage eco-fascism. Thank you all for listening to this lesson. We hope you learn a lot. Please feel free to ask us any questions and look at our website for more videos. Thank you.